everyone, I'm Ansia. My topic today is it ethical to allow access to experimental treatment for terminally ill patients? I want to ask you all a question first. If you or a loved one had a terminal illness, would you choose to wait for the end, or would you choose to try even the slightest chance of an unproven treatment? We cannot deny that everyone has a chance of facing terminal illnesses, and both of these two options are reasonable. As a psychology student, I have read a lot about ethical principles regarding experiments involving human participants. So I want to emphasize that allowing access for terminally ill patients to experimental treatment is ethical, out of respect for their autonomy and hope for treatment effectiveness. I will unfold my presentation from these two aspects, hoping it helps you to consider more objectively. Firstly, terminally ill patients have the right to decide whether to accept experimental treatment. The principle of autonomy can prove this argument effectively. In experimental field, autonomy is one of the basic principles of ethics followed in enrolling volunteers. Those volunteers have the right to decide whether to attend the research based on sufficient information. And in the medical field, autonomy means patients have the freedom to make informed choices about their lives and bodies. Based on how these two different fields related to experimental treatment interpret the principle of autonomy, we can see that terminally ill patients are fully respected for their autonomy and are not forced to participate in any experiments, which also indicates the ethicality of allowing access to experimental treatment for them. Secondly, from an emotional perspective, the potential relief and hope experimental treatment offers to terminally ill patients also support its ethical validity. In Bloomer and his colleagues' study in 2017, a sense of purpose and meaning in life are two main reasons why terminally ill patients choose to attend experimental treatment. Not only because they feel it brings closer clinical monitoring and better care, but they also considered it as a chance to add medical progress. Dr. Benjamin also encourages terminally ill patients to participate in experimental treatments, as rapid advances in medicine are extending and improving the quality of patients' life. Definitely, there are some opposite voices. Some people argue that due to limited research and lesser clinical experience with experimental treatment, terminally ill patients will face significant uncertainty and risk. However, from my opinion, it couldn't become a valid reason to reject access for terminally ill patients to experimental treatment, because for people with few options or even no options, the possibilities that a treatment might work can outweigh concerns about efficiency and safety. I can prove my argument through Jobs' study in 2012. Over 90% of patients stated that they would choose to attend the experimental treatment, even if the experimental drug will cause severe adverse effects, including a 10% chance of death. So all in all, while experimental treatments raise valid efficiency and safety concerns, allowing access for terminally ill patients to experimental treatment is still an ethical way that respects a patient's autonomy and also provides meaning and hope in their life. I sincerely hope that there will be more new therapies for terminal illnesses so that more patients will be treated effectively. That's all. Thank you. This is my references.